Welcome to Run With It, BC's only running, fitness, and health show. On this month's episode, I was in conversation with Tim Hopkins, race director of the Vancouver Sun Run. But first, let's go to our segment on Doctor's Corner. Check this out.
People are living longer because of genetics, also eating healthy and following a healthy lifestyle. In other words, how important it is to have good oral health, especially with seniors?
Extremely important. I mean, as people get on into their golden years, you want to be able to maintain a healthy lifestyle, and certainly having teeth will actually enable you to get that proper nutrition that you would need. We find that with poor oral health, there's actually an increased correlation with cardiovascular disease, stroke, hypertension, diabetes, things like that. So having a good, healthy mouth will actually lead to a good, healthy rest of your body.
And it's a strong indicator that there's something wrong.
Yes, absolutely.
And it's not just seniors, it's for everyone
for sure.
to check. And also to there's I guess 1,300 Canadians have oral cancer?
Yeah, I think the statistic, Christine, is that 0.5 to 1% of the general population will experience some form of oral cancer there, right? So, frequent visits to the dentist will, hopefully be able to allow us to detect that a little earlier. I know in my practice, I actually have a light called a Velscope, which was developed here in Vancouver, British Columbia, and this light allows us to screen for oral cancers. It's a blue light, it's painless, you don't just kind of shine in your mouth, you kind of look at all the things in your mouth, and if something is not healthy or a little different or it's changed, it'll show black on the Velscope, so a dentist would be able to screen for early changes in tissues in the mouth.
Technology has advanced in dentistry.
Sure has, absolutely.
Yeah, so tell us some of your work that you've done with patients, with seniors.
Oh, sure. I mean, I had this one lady, I remember she came to my office from Seattle. She had very, very poor teeth. She had really bad gums as well, and a lot of her teeth were loose and they were falling out. And I ended up removing all her teeth and putting implants in her mouth to support her dentures, and she's just ecstatic right now. She's able to resume a normal, healthy diet. She's enjoying foods like corn on the cob and apples, things that she hasn't enjoyed in years. She actually texted me and told me as such. So yeah, that was actually a very, very heartwarming story. Some of the other things that I do for my patients, Christine, is I make visits to long-term care facilities for patients that do ask me if they happen to have elderly parents that are not able to come to see me regularly. I've actually taken some of my tools and done some dental work in the long-term care facility. Nothing really complex, of course. I mean, I've extracted teeth, or I've adjusted their dentures or their implants and things like that there too, while they're in the facility, so they don't have to make a day trip to take their parents from the long-term care facility to my office and then transport them back.
Not many dentists do that.
Well, I mean, these people are very special to me, and if they ask me to do it, I'm more than happy to make some time to do it for them. So yeah.
So what are some of the concerns seniors have with their teeth? Like you mentioned, like missing teeth. But
missing teeth is one, because of course, missing teeth will prevent you from actually functioning properly there, right? In terms of eating or speaking or aesthetics and things like that there too. So that's a concern. Another concern for seniors is gum disease and gum recession. As we get older, your gums will recede and expose the softer root portion there of your teeth, and also limited or diminishing manual dexterity and some medications that you may be taking for other illnesses and ailments that may dry your mouth or affect saliva flow and things like that there too. So lots of things can affect us as we get older. So it's really, really important to have a dentist stay on top of these things throughout your life. But
throughout your life, and it's also too that some of your patients might have asked you, well, should I get dentures or should I get implants? And it's a choice they make, but it's always best to have your teeth.
Of course, if you can manage it, if you can afford it, it's always best to have in your mouth what God put there in the first place. I mean, try as we might, we cannot replace a natural tooth. So certainly if you have the means and the capabilities to actually save and maintain your teeth, it's probably a good idea. Trying to wear dentures, to try to eat, try to speak and things like that, it's a much different sensation. People lose a lot of confidence when they don't have their natural teeth anymore. It's it's a big psychological change if that were to occur.
Right.
So
So
yeah.
having not your teeth could, not have that confidence. It's like you do everything right, you're following a healthy lifestyle and you have poor teeth. So having your teeth fixed gives you that extra confidence.
Absolutely, and you have your teeth fixed. It also will boost your ability to enjoy the things that life has to offer in terms of foods and speech and conversations and things like that with other people.
Seniors may say or ask, why should I bother? I'm old. Why?
Well, it's all about quality of life, Christine. It's all about your quality of life. I mean, being able to do the things we do on a daily basis and enjoy ourselves is enhancement of your quality of life. So if you have healthy mouth, healthy smile, healthy body, it all ties in with the whole bigger picture that we have what I hope we have for all people. So yeah.
So what are some tips that seniors can follow? Like see a dentist once or twice a year?
Twice a year. Brush and floss your teeth if you can. Eat a healthy lifestyle, or eat a healthy diet rather, and try to limit your sweets. And
it's hard to do sometimes.
Well, absolutely, but I'm not saying live like a hermit, but go enjoy yourself and indulge once in a while. But just everything in moderation, of course.
What about brushing your teeth? Like it's preferred brushing your teeth twice a day.
I would say so. I mean, that's what I would do. I wouldn't ask any of my patients to do any more than what I would do. So once in the morning, once at night is fine. I mean, I don't. You don't have to cart a toothbrush all over the place with you. If you don't brush your teeth in the middle of the day, I really don't think it's going to kill you or hurt you or cause any concerns. But certainly, although I would say that if you do have other ailments like dry mouth, things like that too, an extra session during the day of brushing really wouldn't help you if you have suffer from an affliction like that or something.
Mouthwash?
Mouthwashes are good. All right, just be careful. The mouthwashes actually do have a little bit of alcohol in them, so that tends to dry the inside or lining of your mouth. So just be careful not to use too much, or if you use quite a bit, kind of maybe just dilute it down a little bit. So
it's good information, and thank you very much for coming on the show, Dr. Wang. And
appreciate it, Christine.
We'll have you come back.
Love to be here.
Thank you, and we'll be right back after this break.